Over the course of this series, we've discussed how health data can drive innovation and unlock new business opportunities. But we've also discussed the legal, regulatory, and compliance risks that can arise when using and innovating with health data. That's why informed and deliberate decision-making and proactive planning can be so valuable to companies operating in this space. What do you think about that, Jen?
I completely agree with that, Andrew. We've talked about privacy, consent, de-identification, commercialization, IP risk. All of that leaves very little margin for error when we're talking about healthcare data initiatives. So decisions made early in the process can really impact risk down the line. So what I think we should all do here today, since we're all gathered, is go over some of our key takeaways from the video series, maybe from your own or maybe from others, and leave some practical tips for in-house counsel and executives who are getting started or are already in the middle of this data initiative journey. Jennifer, do you want to kick us off?
Thanks, Jen, and thanks, Andrew. Healthcare data is incredibly valuable, but data monetization isn't just a HIPAA issue. State privacy laws, AI regulation, consumer protection, and national security all play a key part. The key risks here aren't just identifiability, as you've been talking about, it's also inferability. So even de-identified and aggregated data sets can reveal very sensitive information. And I think what organizations need to remember is that transparency and governance are where organizations struggle. So if downstream uses like AI training, analytics, partnerships aren't clearly defined, then contractual liability follows. Legality isn't just the finish line. Trust and reputation matter as much as compliance. The bottom line, successful data monetization requires clear use cases, strong governance, cross-border awareness, and defensible documentation. All are the key factors to reducing risk. Zack, what about you? What are your main takeaways from an IP perspective?
Yeah, thanks a lot, Jennifer. There's a ton of data-centered innovation going on these days all across the healthcare community, and a lot of times it's stuff that your teams are already doing. Our clients are already working on behind the scenes. You don't need to invent a new R&D function from scratch, but a lot of times that requires a holistic IP strategy that leverages patents, trade secrets, other IP rights to really take advantage and safeguard the hard work that your teams are doing behind the scenes. Without letting your competitors ride your coattails and get that second mover advantage. So we work with clients all across the spectrum in this space, from insurers to healthcare providers to startups and AI companies. And we leverage all of these different IPs for our clients' benefits. Maybe I'll turn it over to Jen. Jen, what are your takeaways on this?
Thanks, Zack. I guess from a healthcare regulatory perspective where I sit, the in-house counsel and executives within the healthcare industry, the things I'd like them to remember are that data monetization is permissible, but there needs to be strategic thought around healthcare regulatory issues when planning those strategies. So for example, talking about HIPAA, is your entity a covered entity under HIPAA, like a healthcare provider or a health plan, or is it a business associate, one of those vendors that's providing services to those entities? Because in particular, if you're a business associate, then you're going to need to go through that burdensome task of looking through your business associates agreements to determine what kind of rights you have with the data and if you can even undertake to de-identify it. And then I also want to mention what Sean was talking about from a more general healthcare regulatory perspective, in that, again, data monetization is permissible, but it's important to think about your data initiatives in terms of potential implications under the kickback statute, corporate practice of medicine laws, and the information blocking rules. Andrew, is there anything else you'd like to leave us with?
Thanks, Jen. So litigation and enforcement risk is inherent when using and innovating with health data just by the nature of what health data is and how sensitive and simultaneously valuable it is. I think we would all agree, and this has been a sort of a theme in all of the videos so far, is that an ounce of prevention is worth a pound of cure when it comes to mitigating downstream risk that can arise from using health data. And the most dependable way to do that is to incorporate a legal and compliance overview into the early concept phases of the health data initiative all the way through the operation stages in the life cycle of a health data initiative. And that can mean, practically speaking, interfacing legal and compliance with product developers and IT early on, operations later in the life cycle of an initiative, and then marketing, especially as a health data initiative turns into a finished product and goes to market. And that's really critical from a litigation and enforcement perspective because oftentimes the issues in litigation and enforcement pop up where one of those functions proceeded without legal guidance and got too far down the road. And it's common to see in investigations and litigation, those issues pop up when it's a little bit too late and you're defending the investigation or the litigation. Identifying and managing all of these risks can seem overwhelming at times, but oftentimes the solutions to these problems are simple and they can be done in ways that don't disrupt the company or disrupt the larger goals of the company. And those are things like proactive adjustments to consumer-facing policies or adjustments to contract terms, or we've talked about this a million times, adjustments to business associate agreements and proper business associate agreement hygiene. And all of those things can really pay off down the road and can mitigate downstream risk and give us much better facts in investigations and litigation. We hope that these discussions have been useful to you and your company, and wherever you are in this journey, we're happy to help. Please don't hesitate to reach out to any of us if we can ever be of assistance, and thank you.